Hello, this is Dr. John Daly, Chief Medical Officer of COLA. Today I would like to discuss the topic of balanced billing. At the recent Executive War College presented by the Dark Intelligence Group, there was a roundtable presentation featuring 4 attorneys active in laboratory legal affairs, and they discussed the topic of current issues in clinical lab and pathology law, compliance, managed care contracting, and more. The discussion included many of the topics that have appeared in laboratory publications discussing the increased scrutiny laboratories are experiencing in the audit arena. The first topic discussed was that of balanced billing and co-payment write-offs. This is a timely topic as many insurers and Medicare auditors are scrutinizing laboratory write-off policy of balanced billing. The practice of balanced billing refers to the ability to bill a patient for an outstanding balance after an insurance company submits payments for its portion of the bill. Out-of-network laboratories are not bound by in-network rate agreements when they do not have a contract with the insurer they are billing. And if they are reimbursed at all, there is a remaining balance that is not reimbursed. In these instances, patients may be billed for the remaining balance in its entirety. In-network laboratories must abide by their agreement with the insurer and can only balance bill what has been agreed upon in the contract. In general, we tend to hear balance billing complaints when a patient receives an unexpectedly large bill from an out-of-network laboratory. This is especially problematic when a non-network laboratory performs a high-cost toxicology or molecular tests and receives little or no payment from the insurer because the laboratory is out of network. The laboratory will then directly bill the patient. Many times these come as surprise bills from out-of-network laboratories, and unfortunately this situation has become more common as insurers narrow the laboratory in-network providers, and in addition, patients have higher deductible insurance policies than they did only 5 years ago. An area of concern for laboratories occurs when a laboratory is either not billing the patient for the uncollected amounts billed to the out-of-network insurer, or is reducing the balance it is billing the out-of-network patients. Laboratories will follow this course of non- or reduced fee billing in order to obtain and continue to receive the referrals from providers, and the laboratory does not want adverse comment by the patients about the size of the laboratory bill coming back to the referring clinicians. Many carriers, in investigating out-of-network balance billing and finding either no balance billing or reduced billing, will tell the laboratory it will no longer pay any amount to them for the testing. Under federal and most state laws, submission of a claim to a third-party payer where the laboratory has decided in advance not to collect the full balance of the bill can be viewed as a false claim to the insurer. For example, New York State has ruled that blanket waivers or reductions of patient balances are a violation of the state's fraud and abuse statutes. So what to do if out-of-network? Well, many laboratories are rethinking their pricing of the more expensive tests and are billing the insurer less, and consequently the balance billed to the patient is lower. This is especially true for molecular testing that many times will not be covered under any circumstance, and the laboratory is to reduce the price to a point level where patients will be willing to absorb the entire cost of the test and yet set the price at a level that will show a small profit for the laboratory, but hopefully will generate greater volume. There are times where the patient just is not in a position to pay, and a laboratory can develop a patient assistance program. This program needs to be formalized and written and detail under what circumstances bill balances will be reduced or eliminated. All laboratory sales representatives need to be cognizant of this program so they can discuss it with providers and not commit to foregoing the balance after insurance payment. The patient account representatives must also be educated in the program so they can speak accurately with the patients. In addition, for each reduction or write-off, there should be written documentation of why a given bill represents a hardship and the balance is being reduced or written off. One other balance billing issue was discussed, namely writing off balances for given zip codes, where it is generally known many individuals are economically challenged. While this would on the surface seem to be a reasonable approach, it was stated emphatically that write-offs must be individualized. Thank you for your attention.